Hello, everybody. Why do some adults struggle with acne in their 30s and 40s, even when they eat well, wash their face, and use prescription creams? Why does psoriasis flare during a stress, poor diet, or alcohol use? What if the root cause isn't just your skin, but your liver? Today, we are going to talk about something called liver skin axis and how impaired detox pathways may drive inflammation that shows up on your face. The skin is not just cosmetic. Your skin is the largest organ in your body, an immune organ, a barrier organ, a signaling organ, but it is not designed to be your primary detox organ. That job belongs mainly to the liver, kidney, and gut. When those symptoms are functioning efficiently, waste products are processed and eliminated properly. When they're not, inflammation can spill over. What does the liver actually do? Your liver performs over 500 metabolic functions, including hormone metabolism, especially estrogen and androgens, phase 1 and phase 2 detoxification, bile production, processing most of the medication, filtering endotoxins from gut bacteria, glucose and lipid regulation. Detox happens in two major phases. Phase 1 breaks toxin into intermediate metabolites, often reactive, and phase 2 conjugates those metabolites so they can be safely eliminated, excreted. If phase 1 is active but phase 2 is sluggish, you accumulate inflammatory intermediates and systemic inflammation rises. So, how liver congestion may affect the skin? Let's be clinically precise. The liver does not dump toxins into the skin. However, when the hepatic metabolism is inefficient, hormones may not clear properly. Excess androgens stimulates sebaceous glands and leads to adult acne. Poor bile flow affects gut microbiome, leads to dysbiosis, increased intestinal permeability, endotoxin leakage, elevated inflammatory cytokines, TNF alpha, interleukin 6, and interleukin 17. Psoriasis is strongly immune mediated, but immune signaling is influenced by metabolic and hepatic health. So, what is gut liver skin triangle? Think of it as a three-way axis: gut, liver, skin. If the gut barrier is compromised, lipopolysaccharide LPS enter bloodstream. Liver must neutralize them. Chronic burden increases inflammatory signaling. Studies show patients with psoriasis have higher rates of fatty liver, higher metabolic syndrome, higher insulin resistance. The inflammation is systemic. Skin is just simply visible. That's why you see psoriasis. But problem is deeper. Adult acne and hormonal detox. Adult female acne often correlates with estrogen imbalance, sluggish estrogen metabolism, and insulin resistance, high IGF-1, insulin growth factor 1. The liver metabolizes estrogen through hydroxylation and methylation pathways. If methylation is impaired because low B vitamins, poor nutrition, hormone metabolites, they accumulate and result in sebaceous overactivity and chronic inflammatory acne. Life factors that impair detox. For example, common contributor: alcohol, number one, alcohol, ultra processed food, excess sugar, high omega 6 seed oils, sedentary lifestyles, sleep deprivation, chronic stress, all increase oxidative stress on your body. So, oxidative stress impairs hepatic enzyme system. So, what is the clinical approach to the liver skin axis? If I evaluate patient with adult acne or psoriasis, I look at fasting insulin, A1C, lipid panel, liver panel, GGT, ferritin as an inflammation marker, vitamin D, and gut health symptoms. Treatment focus is not a detox tea, it's a metabolic correction, anti-inflammatory diet, protein advocacy, sleep optimization, resistance training, alcohol reduction. Sometimes targeted supplementation under medical supervision does work. Final things I want you to remember that clear skin is just not topic, it's metabolic. It's manifesting what's happening inside your body metabolically. It could be metabolic, immunologic, systemic. If you only treat the skin surface, you may miss the underlying driver. When liver metabolic pathways are optimized, inflammation goes down, your hormone is under balance, your skin improves naturally. Your skin is a mirror. Your skin is a mirror, your liver is the filter. Support the filter and the mirror clears. So thank you for watching. I'm Dr. PK from Dr. PK Life.